Early warning signs of colon cancer you shouldn't overlook. Colon cancer is often referred to as a silent threat because symptoms may not appear until the disease has progressed significantly. In the U.S., over 100,000 new cases are diagnosed annually, making it the third most common cancer in both men and women. Tragically, it claims nearly 50 lives each year. This condition occurs when abnormal cells in the large intestine grow uncontrollably. While there's no guaranteed way to predict its development, certain early symptoms may signal a problem, some subtle, others more noticeable. Below, we outline 9 key signs to be aware of. 1. Changes in bowel habits. The average age for colon cancer diagnosis is around 60, with half of cases occurring in individuals over 65. However, younger adults can also be affected. One of the earliest indicators is a shift in bowel patterns. A healthy digestive system typically produces regular, soft stools that are easy to pass. If you notice persistent changes, such as increased frequency, difficulty passing stool, or unusual hardness, it's worth discussing with a healthcare provider. Frequent loose stools, defined as 3 or more unformed bowel movements within 24 hours, can be a red flag. While diarrhea may stem from conditions like irritable bowel syndrome or infections, its persistence warrants evaluation, especially if accompanied by other symptoms. 3. Chronic constipation. The colon plays a crucial role in waste elimination and nutrient absorption. When it becomes obstructed or sluggish, constipation can result. Though often dismissed as minor, prolonged constipation lasting more than 3 days may indicate an underlying issue, particularly if paired with abdominal pain or bloody stools. Early detection dramatically improves outcomes, with a 5-year survival rate of 95% for localized cases. Visible blood in stool, whether bright red or dark, should never be ignored. While causes range from hemorrhoids to ulcers, it's essential to rule out serious conditions like colon cancer. 5. Rectal bleeding. Bleeding from the rectum, though commonly linked to benign issues like fissures or polyps, can occasionally signal cancer. Any unexplained bleeding merits medical attention to determine its origin. Unplated, bloating, or abdominal pain, genetics and lifestyle factors such as poor diet or smoking contribute to colon cancer risk. Persistent bloating or discomfort in the abdomen, whether due to gas, dietary triggers, or something more serious, should be monitored, particularly if other symptoms arise. 7. Persistent fatigue. While tiredness is common, unrelenting exhaustion despite adequate rest may indicate a problem. The colon's role in waste removal means dysfunction can lead to toxin buildup, potentially contributing to fatigue and other systemic issues. 8. Sudden weight loss. Losing more than 10-15 pounds unintentionally over several months could be a warning sign. Though weight fluctuations occur with age or illness, drastic loss without explanation warrants investigation. 9. Early satiety. Feeling full despite eating little may point to digestive disturbances linked to colon cancer. Bloating, irregular bowel movements, or appetite changes can mask more serious concerns if dismissed as minor. Risk factors and prevention. A balanced diet, regular exercise, and maintaining a healthy weight can reduce risk. Those with a family history of colorectal cancer, especially in first-degree relatives under 55, face higher odds. African Americans also experience elevated rates, possibly due to disparities in healthcare access. If you recognize any of these symptoms, consult a healthcare professional promptly. Early intervention is critical, and screenings like colonoscopies may be recommended based on individual risk. Prioritizing your health through awareness and proactive care is the best defense against this disease. Additional risk factors to consider. While the symptoms above are key warning signs, certain factors can further increase your likelihood of developing colon cancer. The cases rise significantly after 50, though cases in younger adults are increasing. Family history. Having a parent, sibling, or child diagnosed with colorectal cancer, especially before age 55, doubles your risk. Chronic conditions like Crohn's disease or ulcerative colitis elevate risk over time. Lifestyle choices, smoking, heavy alcohol use, a diet high in processed meats, and low fiber intake are linked to higher rates of colon cancer. And obesity and inactivity. Excess weight and a sedentary lifestyle contribute to inflammation and metabolic changes that may promote cancer growth. When to seek medical advice. If you experience any of the symptoms mentioned, especially if they persist for more than a few weeks, schedule an appointment with your doctor. Early-stage colon cancer often has no obvious signs, which is why routine screenings are crucial. Screening options. Colonoscopies, the gold standard for detecting polyps and early cancer, recommended every 10 years starting at age 45 or earlier for high-risk individuals. Stool tests, non-invasive options like FIT, fecal immunochemical test, or Cologuard can detect blood or abnormal DNA in stool. Flexible sigmoidoscopy examines the lower part of the colon and may be combined with stool testing. Prevention strategies. While not all cases are preventable, these steps can significantly lower risk. Meet a high-fiber diet. Focus on fruits, vegetables, and whole grains to support digestive health. Limit processed meats and red meat. Studies link excessive consumption to higher cancer rates. Stay active. Regular exercise helps maintain a healthy weight and reduces inflammation. Avoid smoking and excessive alcohol. Both are known carcinogens that damage the digestive tract. Know your family history. If colon cancer runs in your family, discuss earlier or more frequent screenings with your doctor. Final thoughts. Colon cancer is highly treatable when caught early, yet many delay seeking help due to vague or overlooked symptoms. Paying attention to your body, understanding risk factors, and staying proactive with screenings can make a life-saving difference. If anything feels off, don't hesitate to consult a healthcare provider. Your vigilance could be the key to early detection and successful treatment. Taking charge of your health today ensures a stronger, healthier tomorrow. Stay informed, stay aware, and prioritize regular checkups to protect your well-being. Understanding the stages of colon cancer. When colon cancer is diagnosed, doctors determine its stage to guide treatment decisions. The staging system ranges from 0 to IV, based on how deeply the cancer has grown into the colon wall and whether it has spread. Abnormal cells are only in the innermost lining of the colon. Stage 1, cancer has grown into deeper layers but hasn't spread beyond the colon wall. Stage 2, cancer has penetrated through the colon wall but hasn't reached lymph nodes. Stage 3, cancer has spread to nearby lymph nodes. Stage 5, cancer has metastasized to distant organs, e.g. liver or lungs. Early stage cancers, II, are often treatable with surgery alone, while later stages may require chemotherapy, radiation, or targeted therapies. Treatment options depends on the cancer's stage, location, and your overall health. Common approaches include 1. Surgery. Colectomy, removal of small early-stage polyps during a colonoscopy. Colectomy, partial or full removal of the colon, sometimes with a colostomy, temporary or permanent. 2. Chemotherapy, drugs to kill cancer cells, often used before/after surgery or for advanced cases. 3. Diation therapy, typically used for rectal cancer to shrink tumors before surgery. 4. Immunotherapy and targeted therapy, newer treatments that help the immune system attack cancer or block specific growth signals in cancer cells. Living with colon cancer. A diagnosis can be overwhelming, but many people live full lives during and after treatment. Support strategies include nutrition, work with a dietitian to manage side effects like appetite loss or diarrhea. Mental health, counseling or support groups can help cope with emotional challenges. Physical activity, gentle exercise as tolerated, may reduce fatigue and improve mood. The importance of early action. Colon cancer is preventable and highly treatable when caught early. If you're over 45 or have risk factors, talk to your doctor about screening. Even if you feel fine, screenings can detect precancerous polyps before they turn into cancer. Remember, symptoms like persistent bloating, blood in stool, or unexplained weight loss should never be ignored. Your health is worth prioritizing. Don't delay seeking answers. By staying informed and proactive, you can significantly reduce your risk or catch problems early when they're most manageable. Your future self will thank you. Final thoughts. Colon cancer may be common, but it doesn't have to be devastating. With modern screening methods, many cases can be prevented entirely through polyp removal, and early detection leads to highly successful treatment outcomes. The key lies in being proactive, knowing your risk factors, recognizing potential warning signs, and committing to regular screenings as recommended by your healthcare provider. Your body often sends signals when something isn't right. Listening to those signals and acting promptly could make all the difference. Whether you're in your 30s or your 60s, prioritizing colon health through lifestyle choices and medical guidance is one of the most important investments you can make in your long-term well-being. Stay informed, stay vigilant, and remember, when it comes to colon cancer, knowledge and early action are your greatest allies. Your health journey matters. Take the next step today.